Hello everyone, my name is Steve Iduye. Today I am talking about the International Resident Assessment Instrument that is popularly known as interRAI LTCF. I hope you would find this video informative and helpful in improving the provision of care in long-term care settings. What is interRAI and why do nurses and other clinicians have to use the tool in long-term care facilities? 1. The Canadian Institute for Health Information (CIHI), in partnership with interRAI Consortium, support the implementation of the interRAI LTCF assessment system in Canada. 2. At the point of care in nursing homes across Canada, nurses use interRAI tool during resident admission to the homes. They also use the tool at every quarter and annually for resident health assessment and to generate care plans that are customized for the resident's individual needs and preferences. 3. Completing an interRAI assessment enables a healthcare provider to assess key domains of function, be it mental and physical health, social support, and service used by the resident. 4. The assessment and care plans from the interRAI tool are based on the preferences and the needs of the resident. This allows the resident voices and their families to be part of the care provision throughout the stay of the resident in nursing homes. 5. Different vendors host the assessment tool in long-term care, but they all have to comply with CIHI applicable standards. So don't be surprised if what you use in your nursing home, the name is different from the type of interRAI that is used in other nursing homes across the street. They are all the same interRAI assessment tool, except that they have different vendors and different names. The importance of interRAI tool in the provision of care for long-term care residents and also at the organizational level in terms of management, policies, and research is enormous. Because this instrument is data-driven, nurses use the interRAI assessment findings to formulate the care plans with the residents and their families. Nurses and other clinicians also use the outcome measure component of the tool to check the resident care delivery for quality. At the organizational level, the long-term care management use the case mix classification function of the tool to improve resource allocation. They also use the quality indicator function of the tool to compare resident health status across multiple long-term care homes using performance scorecard. So this helps them to be able to manage the long-term care facility successfully, knowing where things are going wrong for the residents and knowing where things need improvement for the residents. What are some of the benefits of interRAI LTCF use in long-term care facilities? 1. All interRAI LTCF has core assessment items and use standardized language, which allows easy access for information sharing across sectors in a consistent and reliable way. 2. Evidence suggests that the interRAI assessment tool is reliable and valid in the management of chronic diseases of residents in long-term care facilities. 3. The simplified terms and common definitions in interRAI assessment tool help improve assessment accuracy and the right care plans for the resident. 4. The assessment tool provides clinicians with real-time feedback for care planning purposes. 5. The assessment tool supports outcome-based measure of the quality of care a person receives in long-term care facilities. Are there challenges or problem areas with interRAI LTCF use in long-term care facilities? There are many challenging areas or problem areas with the use of interRAI tool in long-term care facilities. To mention a few, in many literatures, it is indicated that how the assessment findings from the application translate to better outcomes for the resident is poorly investigated. 2. Studies found that care planning processes differ significantly despite the use of interRAI to coordinate care. 3. Study also found that those who coordinate the care planning activities are often disconnected from those who implement the care to the resident, which create discrepancies in the resident health outcomes. 4. There is also a problem of exclusion of personal support workers from the clinical team in long-term care. And this set of people are said to provide between 80 to 90% of care, basic care, to long-term care residents. 5. There is inconsistent clinical information sharing among care coordinators, registered nurses, and other care providers in long-term care. Since there are many problem areas that impact the translation of interRAI assessment findings into quality care for the residents, improving the problem areas in interRAI use will require a multifaceted approach and the collaboration of clinical and non-clinical staff in long-term care facilities. For more questions and clarifications on the content of this video, or for questions on the applicable trainings or deployment of interRAI tool in your long-term care facilities, please reach out to the following addresses, and thank you so much for your time.